Good morning. Welcome to Skin Science Sunday at Sasha. Hope you're all doing well. Hope you and your loved ones are keeping safe through this pandemic. Today, I'm going to talk about COVID-induced hair loss. We get complaints of hair loss from people who have had the infection, say about 6 weeks ago, and it sometimes might take as long as 6 months. So what are the factors that is causing hair fall? First, stress. Stress-induced hair fall. Second, lack of nutrition. You have loss of smell, loss of taste, hence loss of appetite, and also there's a need of excessive nutrition for the body to repair itself. Third, oxidative damage because there's a lot of free radical that is released due to so many reactions in the body. Fourth, inflammation. There's inflammation in the body which happens due to the COVID-19 disease. Now, coming to the mechanism behind COVID-19 hair loss. In people with pre-existing hair loss, it actually acts as a trigger for much heavier shedding. But what about people who've never really had hair loss as a major concern? But now they're experiencing quite a bit of hair shedding post-COVID infection. As we all know, hair has 3 stages. Growing phase, that is there's anagen. Resting phase, that's the telogen. Shedding phase, that's the catagen. Hair must stay longer in the growth phase as compared to the resting and the shedding phase. Now, in an infection like COVID, the body's response to stress, our growth phase of the hair, which is an anagen, now suddenly turns into the resting phase, which is the telogen. So this transition takes about 6 weeks post the infection to set in, and then you have the shedding phase where you will be losing clumps and chunks of hair, or you can even say massive hair loss or shedding. This is usually the principle that happens. Your growth phase is suddenly arrested and then you will transition. You do have a lot of shedding in this phase, so the medical term telogen effluvium. So each hair strand becomes thinner, the entire hair falls from the root that burns your heart and stresses you further. Now, if you are a person with the good dense hair, before the infection, this might be a very self-limiting condition. Usually, you'll have an onset of hair fall about 6 to 8 weeks post the infection, and it can last for 3 to 4 months. But it might take as long as 6 to 18 months on average to recover. In an individual who already has hair loss, this can actually make things go out of control. You'll actually have a lot of hair fall with increased scalp visibility. So what can we do about this? Next Sunday, I'm going to talk about how to control COVID-induced hair fall. Till then, stay safe and take care. Bye.